Yes, this was, I'm from the Training for Health Equity Network, and I was lucky enough to have two colleagues from member schools. It's a partnership with schools that are specifically trying to address health workforce needs and health needs in disadvantaged communities, and under social accountability principles. So we have Dr. Jehu Iputo from Walter Sisulu University here, and then I have Dr. David Marsh from the Northern Ontario School of Medicine. So we had a really rich discussion. When the group came together, they actually developed an evaluation framework to try to measure how well health professional schools are meeting the needs of the communities and the health systems that they operate in. And during this discussion in the last few days, there's been a great focus on how to better link education with service delivery. And so the question that we were focusing on is actually what are the indicators? What should we be measuring to see whether schools are addressing and meeting the needs of the health systems that they are serving? So we had a really rich discussion, and interestingly enough, the idea of collaborative leadership is essential for this change to happen at top level and throughout all levels. And that's the only way to start bringing these systems together. What came also, we had a really rich idea of how to start measuring that, but what came repeatedly up is that we have to start looking at outcomes, health systems and health patient outcomes. So there was some great suggestion as to the need to actually start with looking at what are the community needs and how we do that together with the communities, but not only the communities, but also the end users of the health professional that we produce. So there were several suggestions in terms of outcome measures. One would be, across the globe, the issue of chronic conditions account for a really big part of healthcare spending, but it also is reflected, you can see in terms of disadvantaged communities, they may be bellwethers for seeing whether we're actually meeting needs. So there were suggestions around really starting to make that link with looking at outcomes from an interprofessional perspective. And actually somebody from the World Bank was telling us about how they actually discuss with other users of health workers, meaning, it could be insurance companies or pharmaceutical companies or other in various different sectors, and ask them, what do you need? What kind of competencies you need? And the same thing goes for communities, that you actually talk to those that you're trying to serve. So several other ideas that you could look at. You obviously clearly need to define the needs you're trying to make, and that may be the hardest question, to start with, well, who are we actually serving, and what particular needs are we trying to address? So that would be very context specific, and something that probably be a really useful exercise for all schools to do. And another thing which came as a great suggestion is that it was important to involve the students from the beginning, to participating in doing these kinds of assessment, to perhaps going out, to the communities to try to understand what the needs are, because they will become the advocates and the future practitioners. So they're obviously a key element to maintaining that link. But it also came clear that you should be trying to look at, are there actually feedback loops to, for example, see, is the curriculum actually reflective of what the needs that we as a school defined, that was said that we were addressing? Is that reflected in the curriculum? Are the resources put to meet those? So, for example, in terms of social accountability, is the funding going to these? Or is it just looking really nice on paper and you have that in your newsletter? Or are you actually, as an institution, putting resources into training community preceptors and so on and so forth? So another thing which was really important, and that has also been brought up in John Norsini's discussion, is tracking graduates. Where do they go? What kind of career choices are they making? Where are they working? And there were some great ideas about tracking by zip codes, and really finding ways to see whether it's having the impact. Are we actually, if you work in a rural state or if you work in an urban community where there's maybe a disadvantaged population, or do people that you graduate end up working there? And same thing with
I'll just ask you to wrap up a
Yep.
little bit. Thanks.
Same thing with clinical assessment. Clinical sites, are they reflective of the communities you want to do? And then there was just a final interesting question that came up at the end, which is really, we tend to organize based on education, research, and services. But should we actually go further up and start with the needs, the communities, and then depending on what is needed for these communities, maybe it's more research-oriented, maybe it's more service-oriented, or maybe it's about changing the education.
Thank you very much, eloquently put. And our last table, and Jan, being last means that I've already been told we're over time. So I will ask you to be brief and succinct with your very big topic of transformational leadership.